I want you early in bringing on a hygienist to your practice to do some in-service training between you, doctor, and your hygienist. It could be the rest of your team because it can help calibrate the rest of, if you have multiple hygienists. I want you to do this in-service training. And specifically, a part of that training is I want you to share with the hygienist your clinical approach. Your clinical approach. For example, you might say, hey, I want to show you some befores and afters of when I see this, this is what I like to do. When I see this, this is concerning. For example, maybe old amalgam fillings. You can pull up a bunch of photos of old amalgam fillings and you can show examples of, hey, here are some that are still in service and still working. We don't place new amalgam fillings, but we have patients that come with old amalgam fillings. I want to show you the difference of one that is still being useful versus this one over here that really needs to be replaced. And what I've learned over the years, Naren, with hygienists is they don't have much training in hygiene in their hygiene school on restorative dentistry. They don't have much training. And so you need to provide them that because I want our hygienist to be your partner in encouraging people to accept your treatment recommendations. Your hygienist can be your most effective partner. So they can say things like, Naren, I see the doctor has recommended some fillings on your upper left, and I noticed those haven't been taken care of. Today, when doctor comes in, I'd like him to take a look at those fillings and give us a status report, because these things don't get better on their own. They only get worse. And I want him to take a look at that, and maybe he can give us a status report on those fillings. So without some training, they can't have that conversation. They can't be your partner. If you're doing adult orthodontics, let's say you're doing aligner, Invisalign or ClearCorrect, your hygienist can be awesome at that. She can look for crowding or spaces. That's all she's looking for, crowding or spaces. And she can say to the patient, Naren, if there was a way, I'm being hypothetical here, if there was a way to correct the crowding in your teeth without using brackets or braces, would you have any interest in that? And many patients, sure, I just didn't want to look like I was in middle school again. Well, we have a state-of-the-art adult orthodontics called Invisalign. When doctor comes in today to do the exam, I'm going to ask her to take a look and see if you're a candidate for Invisalign. Would that be okay? Oh, yeah, thanks. And now you do a pass-off to the doctor. Dr. Naren is interested in correcting the crowding in his teeth with Invisalign. Would you do me a favor and take a look and see if Naren's a candidate for that? But they can't have those conversations without some training, without some in-service training. So I want you to devote some in-service training and help calibrate, I'm using that term, calibrate your new hire with you clinically. It's not going to happen overnight. And by the way, it's not one and done. This is something you should do on a regular basis with your hygiene team members. And really calibrate them, because they can be your best partners in terms of motivating and encouraging people to take a greater interest in their mouth and to schedule unscheduled treatment. But they can't do that. Hygienists don't want to step in the mud. They don't want to maybe talk to the patient about something. Let's say, let me give you a what not to do. Sometimes we learn what not to do, and it can be as helpful as learning what to do. And let's say the hygienist thinks that this crown on the upper left is a problem. And the hygienist says to you, Naren, I'm concerned about that crown on your upper left. It looks like it may need to be replaced. I'm going to have doctor take a look at it when she comes in. And now imagine the hygienist making a pass off to doctor. Doctor, would you do me a favor and look on the upper left? That crown that Naren has on the upper left looks to me like it may need to be replaced. Can you do me a favor and take a look? And imagine the doctor said, no, everything's fine. That's fine. How is the hygienist going to feel at that point, Naren?
Yeah, the hygienist would feel, kind of devalued or, like embarrassed. Yeah, because she thought something is important or something needs to be done, and then doctor kind of contradicts her.
And, human nature, when a toddler touches the stove, they aren't likely to touch the stove again.
Yes. Never doing that again.
Near that stove again. So
Yeah.
I'll be darned if I'm going to ever bring up any treatment again. So, but you can avoid all that by helping them get on the same page as you. Now, granted, a hygienist can't diagnose according to the Practice Acts. I'm not so sure I agree with that, but to be politically, to be dentally politically correct, hygienists are not able to diagnose according to the Practice Act in all 50 states. But they certainly can identify concerns. But you want to get on the same page as you.